I'm going to start with a video, but before I do, I have a few things I just wanted to mention. And I have my magic notes right here. First, thank you, David. And I'm not sure if Claudia is in here, but I really appreciate the invitation and the opportunity to showcase one of the initiatives that we are supporting at AstraZeneca called our Lung Experience Initiative. And also wanted to mention, for any of you that may be in the room that attended the I-ELCAP conference in Verona in 2023, you might remember I actually mentioned that we were going to pilot this particular project, but we had not done anything yet. So I'm really excited to be back here today to share the results. And with that, when we did the initial pilot, sometimes you just never know what can happen. We actually caught the attention of the leadership of a large major national grocery chain in the US that has a mobile health program and sponsors NASCAR. And so this project really demonstrates the power of partnership and collaboration and reflects AstraZeneca's commitment to eliminating lung cancer as a cause of death by supporting these early detection initiatives. And now, to kick things off, I have a short 3-minute video that I'd like to share. And if I could do it over again, it wouldn't be 3 minutes, because I know TikTok has sort of like redefined what our attention span should be. So I ask you just bear with me and watch it to the end, and then we'll talk afterwards. So.
We're here today in Michigan at the Michigan International Speedway.
We're here today at the Ohio State Fair here in beautiful Columbus, Ohio.
Today we're in Kroger parking lot here in Jackson.
So we're out here in Toledo. There's a Rib Fest.
We're up at Pocono Raceway today.
It's amazing to be here in sunny California to just raise the awareness around lung cancer screening.
It's a healthcare roadshow that AstraZeneca is really proud to be a part of.
We got the big lung experience here to help draw attention for the need for not just lung cancer screening, which is important, but also just cancer screening and health.
People are able to wear their headphones and really learn about what are the challenges and opportunities, one has in terms of diagnosing and screening.
Supporting events like this allows us to help bridge that access barrier and really bring and deliver healthcare services to the community.
Right now, nationally, lung cancer screening is in single digits. So it's really, really sad to think that there are eligible patients that are not getting screened.
People can walk through it and learn more about how the lung functions, when it's healthy, when it's not healthy, and what symptoms to look out for.
It's our hope that people who do go through will be able to either relate to going and getting a lung cancer screening for themselves, or if they've got a family member or a loved one that they're aware of that might meet eligibility and need screening, that they go and share that information.
All of these screenings, they help lead to better outcomes for patients if we can catch the disease early and get them diagnosed, treated, and on medicines or treatments.
Thank you.
AstraZeneca is really committed to bringing out new and innovative medicines, but we have to do it in partnership.
Kroger Health has their whole mobile health unit here today where individuals can get important life-saving vaccines. They have biometric health screenings. So that's one of the benefits of being part of this collaboration.
So we're trying to make sure people are aware of the fact that screening is available to them. It's very easy. It takes a couple of minutes. If they do have any problems, we hope they catch it early so that we can have solutions and keep people around as long as possible.
It takes a village to help get the information to people that they feel comfortable about going out and doing the right thing for their bodies.
So our collaboration with Kroger between now and the end of the year, we're hoping to check the box on 50 large community events. Today we're at a state fair. We've got quite a few NASCAR events, just some other large-scale community events all across the country.
We got the NASCAR here, we've got the lung here, we've got 100,000 fans that are coming out here today. We're a team to revolutionize cancer care in the United States.
So that's our lung experience. And sometimes it's just easier to demonstrate it in a video. And one of the, well, purpose of it obviously is to empower and really is to focus on empowering people with knowledge to drive educational awareness. Our hope is they leave there and they go back into their communities and get screened because they're empowered by what they learn. And I'll tell you, when we do these kind of initiatives, you're always wanting to know what is the impact, how do you really assess it? And that was our challenge when we did this last year. We kind of started out and said, okay, now this year we got to figure out how do we measure impact. It's really challenging because you think, okay, we're going to make an impact, but what is it? So one of the things that we did recently is we instituted a brief survey, or at least the organization that handles all of this for Kroger and the other partners, did a survey and collected responses from attendees. And what we started to assess is we assessed those based on age. So if anyone responded that they were 50 or over, it prompted, used some logic and asked if they had like a smoking history of at least 20 years, and then basically assess them on whether or not they've been screened, if they're willing to go get screened, that sort of thing. And so this is just an example of one of the last data that we had collected through September. There's a lot more data since then, but we had nearly 5,000 people respond to that particular survey. And what I think was really interesting is granted, this isn't super scientific. It's just sort of like, how do we assess? But what I thought was really interesting is of those 5,000 people that responded, about 20% indicate they are eligible for lung cancer screening. And we saw that of those that said, hey, I'm eligible, we're about 35%, according to the last data that we collected, had responded that they've actually already been screened, which I thought was encouraging. And then about 42% indicate they're committed to going back and actually getting screened. And what I want to leave you with two things that I think was really important. At one of the last events in the last couple of weeks, they reported back that an attendee came to them and said, hey, I was at a NASCAR event in another state, and as a result of this exhibit and you guys talking to me, I went home and I got screened for lung cancer, and I want to thank you. And I thought that was really powerful. Here we have someone who actually validated and said, yes, we went and did it. We hope to broaden this in 2026 and bring on another partner that actually has the ability to assess that downstream, to be able to take that 20% or that 43% of the people who say, yes, I'm going to go get screened. Here's my email address, follow up with your navigator program, and then we'll be able to see if they are actually getting screened. And lastly, what I have, these are just some examples of the tools that we use. The videos that are in the actual lung, we've pulled those through on some little fans so they can carry them and sit and scan them. And we've pulled those through on some educational pamphlet as well. And we don't just focus on lung cancer screening. We leverage this opportunity to talk about COPD and asthma as well. And the final thing, which we did touch on in the video, that's really important. One of the challenges when it comes to screening is not everybody sees primary care every year. So half the population in the US is not getting that messaging. And programs like this, actually, we are able to go to where the people are to help encourage them to go to their doctor. And I have 30 seconds left. I did that. I can't believe it. And that's it. Thank you very much. I appreciate the opportunity.